Thank you so much for having me. I'm going to be talking about Vaccine Hunters Canada. So I'll start off with a bit of background and then go over our operations and how we worked during our peak kind of vaccine hunting, a bit about our growth as an organization, and then finish off with where we are now. So first, a bit about me. So I'm studying chemical engineering at the University of Waterloo. I started my master's back in September. And I joined Vaccine Hunters Canada in April 2021. When I joined, we had under 10,000 Twitter followers, and the team was fewer than 10 people large, and it's grown significantly since then. So I started as a community moderator on Discord, and then also took on social media posting and communicating with clinics and public health units. So a bit of background about the organization. It was founded March 19th, 2021 by Andrew Young, who's at the front of the photo holding the stuffed turtle there. So he was looking for vaccine appointments for his parents and having a bit of trouble with it, and set up different tools to help himself. And once he got his parents' appointments, he realized other people were also having trouble. So he created Vaccine Hunters to share the information that he was finding. We are 100% volunteer run, not affiliated with any government or public health organization. And we don't accept any kind of donations. We direct anyone who wants to donate to the Frontline Fund, a charity I highly recommend everyone checks out. So our goal as an organization has always been to help people navigate the COVID vaccine rollout, understand eligibility, and connect eligible Canadians with appointments. So how do we do that? So we share eligibility updates and vaccine appointment availabilities via social media. Primarily Twitter, Facebook, and Discord, but we do have a presence on Instagram, Snapchat, and Nextdoor as well. So all of our posts would be put out simultaneously onto Twitter, Facebook, and Discord. You can see an example on the left there. And then we also provide direct assistance via Discord, emails, and DMs. So we are spread across a bunch of different platforms to try and kind of capture different demographics. The people that we get sending an email with a question are very different than the people we might have on Discord or in our Twitter DMs. And the same with posting updates. The people who are active on Facebook aren't necessarily the same people that are active on Twitter. And we've used Discord as our kind of main hub. So it's where all of the kind of behind the scenes team organization and communication happens. And it's also where we get a lot of information from the community and interact with the community the most. So we have it split up into different channels based on different provinces and then regionally as well. So people could have very specific information and go right to the region they're in to get help and answers. And then we also had a channel on vaccine safety where people could get questions answered by a verified health team. And specifically questions on vaccine safety. We didn't do any kind of health questions, but it was a good place for people to go if they had concerns or questions about the vaccines and either didn't know anyone who was qualified to answer, or maybe they were embarrassed to ask the question, and it was a safe space for people to go and have their questions answered and talk through their concerns with someone who was maybe an expert on it or knew what they were talking about. So we also worked with public health units and vaccine clinics to share information on pop-up clinics and walk-ins. We would liaison with pharmacies to share appointment information and ensure end-of-day doses aren't wasted. So there's some example tweets and Facebook posts there. We would have all of our tweets and posts go out with hashtags based on the region or province, as well as whether it was first or second dose, so that people could find relevant information for them. And we made sure that all of our tweets were very kind of upbeat tone and excited, because it's something to be excited about going to get your vaccine. So to do this, we have quite a large team. We currently still have about 75 people active. We have 29 alumni and 4 partners, so partner organizations. And the team's broken down mainly into the groups on the left. So directors, the communications team, which is they're kind of in charge of social media, all of our messaging, things like that. The software projects team, which I'll talk a bit about their work later. Our health team, our social media contributors, and the Discord community moderators and ambassadors. And there's quite a bit of overlap between the social media contributors and the other groups. And then within the contributors and moderators, we had people that focused on specific areas. And again, there was some overlap. So people that focused on pop-up and mobile clinics, our pharmacy liaisons, the DIY and SOS teams, which I'll talk about a bit later. We had a group that specifically focused on Nextdoor as a social media platform. And then of course, our partner organizations. And then also a very big part of why we were able to grow the way we did and help people as much as we did was the community around vaccine hunters. So not just the people directly in the organization and part of the team, but everyone that followed us on Twitter or was part of the Discord that took the information we put out there and just really ran with it. So we would post a tweet about an appointment being available, but it was people in the community that would then text, their friends, their families, their coworkers, and try and get them booked in and help the people around them. So we really, our reach wouldn't have been anywhere near the same without that. We really tried to reach the vaccine hunter in a household so that they could then take the information we put there and book their grandparents in if they weren't as tech savvy. And we even had one case where someone saw some information about a pop-up clinic that had opened up eligibility. So they hopped in an Uber and went right there, and they were able to convince their Uber driver to get in line with them and get vaccinated as well, which was a really great story to hear. So we started with Andrew alone tweeting about availabilities, but grew exponentially from there. At our peak, we were putting out about over 100 tweets a day, sometimes even hitting over 200. We had over 280,000 followers on Twitter and an audience of about 470,000 people across all of our platforms. So of course, our operations evolved with our audience growth. The approach we had at the beginning wouldn't necessarily work with 10 times as many people following us. So initially, most of our information was crowdsourced and it came from web page tracking. We did continue to get information for that as we grew, but with our growth and as we became more of an established and known organization, we were able to set up verified sources and contacts. So we could, if we had conflicting information coming in from the community and crowdsourced, we could go right to a clinic and ask them what the eligibility was and talk to them directly. And that also helped control on our end the kind of messaging that we were putting out about that clinic and making sure that we were working with them and helping them, never hindering them in any way. So we had to be cognizant of our audience size and clinic capacities. We never wanted to overwhelm the clinic. So we also had very strict policies on people attempting to skirt eligibility requirements. So we would have a warning and then remove people from our Discord and social media if necessary, because certain groups are prioritized based on whether they were more vulnerable to COVID and needed to be vaccinated first. And that was something we really worked to stick to and encourage that everyone got vaccinated when they were eligible, but not sooner. And one way that we did this was through our color system for clinics. So we had a red, yellow, green color system. So if a clinic was assigned red, we wouldn't do any social media posts and any mentions of it would be removed from our Discord. And so this was for clinics that were either extremely targeted at certain demographics and certain communities or extremely low barrier. So for examples of targeted clinics, there were clinics that were targeted at certain, like for people of color or for the LGBTQ plus community. And we wanted to make sure that they were reaching their target demographics before they opened it up. And then some clinics were targeted towards people without any kind of documentation to make sure that they were still able to get vaccinated. But it meant it would be easier for people that had already gotten a first dose to get a second one earlier. So we made sure to really shut down any discussion of that and try and help the clinic reach who they were actually targeting. And then if a clinic was labeled as yellow, we would not do any social media posts, but we would allow discussion on the Discord. So this would be if they had a limited number of doses, because our Discord audience was much smaller than our social media audience. We would be able to share it with fewer people, so the information still got out there and maybe end of day doses were still used up, but we weren't sending a whole flood of people to a clinic that could handle it. And then if a clinic was labeled as green, we would post about it on social media, share it on Discord, shout it from the rooftop. So anything to get the information out there. And as we grew, we also worked on translating resources. So we put out some of our own resources, like information on how to get vaccinated if you don't have OHIP. We made sure to translate those into as many languages as we could. But we also sometimes were given resources that were already translated. So posters for different pop-up clinics. And we would make sure to translate the associated tweet that we would put out. And we did that through both people on the team that knew the languages as well as crowdsourced translations, which was really great. We had a channel on our Discord and community members would help out wherever they could. And we also had a big focus on continuous improvement. Very few of us had any experience as a kind of grassroots organization. None of us expected it to get as large as it did. So we were really open to taking any kind of feedback on board. One example is a few months into all of our tweeting, someone on Twitter put out there that the way that we used emojis and the amount of emojis we were using in our tweets was inaccessible for people using screen readers. So if you don't know, screen readers will read out a description of every single emoji in a tweet. So if you have too many, it's really, really difficult to get the content out of that. So somebody brought that back to the team. We had a short discussion about it, and we stopped using emojis entirely to make sure that everyone that needed our help was getting it. And so for our impact, it's estimated that we helped 1.2 million Canadians, and this was calculated based on our audience and the assumption that each person following us helped 3 other people. And I'm just going to take a moment to talk about our initiative called Find Your Immunization, FYI. This is a tool for finding COVID vaccine appointments based on your postal code. It's just a website you can go to. So the open appointment data is pulled directly from pharmacy and regional sites with permission. And then for some pharmacy chains that we don't have direct permission, pharmacists can enter the data manually. It's all open source code. No user data is saved. And we're currently working with the World Health Organization to share our learnings in code with other countries. So where we are now. On August 31st, we pivoted away from directly posting about eligibility and appointment openings towards a self-serve model. And so we currently have 3 tools that people can use. The first is, as I mentioned, FYI, Find Your Immunization, where people can enter the postal code and find pharmacy appointments near them. The second one is Vaccine DIY, which is a do-it-yourself info listed by province. So there's information on eligibility, open appointments, clinics, anything you might need to get a COVID vaccine in that region. And then the final tool is our SOS vaccine help form, where if you've gone through FYI and DIY and you still need help or you're still confused, you can submit this web form and one of our volunteers will get back to you within 48 hours or 2 business days. And so this is just a little infographic on how anyone can be a vaccine hunter. Like I said, there were 100 of us volunteers, but hundreds and hundreds of people in the community that were necessary for us to do this work. And so I just want to take a moment to encourage everyone to reach out to the people in your lives, see if they've gotten their COVID vaccine, and if they haven't, what you can do to help them with that and help support them through that. And just because it's flu shot season, go get your flu shot while you're at it. And so this is the Vaccine Hunters team, or some of us. And if you go to vaccinehunters.ca/team, you'll see a list of everybody that's been involved. So I'm happy to take questions now.
Thanks, Natalie. Please join me, everyone, in a virtual round of applause for Natalie. Thank you very much. Thanks for your presentation.